The Chinese President Xi Jinping says his country is waging a serious fight against the demon coronavirus outbreak. Well, the virus has now killed more than 100 people in China, and new cases have been confirmed around the world, including Germany and Japan. President Xi, in a meeting with the head of the World Health Organization, pledged transparency in his government's efforts to contain the disease. He said, "The epidemic is a demon, and we cannot let this demon hide." Hong Kong's leader, Carrie Lam, has been outlining measures that include restrictions on high-speed train and ferry services.
One of the keys to controlling the epidemic is to substantially reduce the flow of people between the two places. In other words, we are not just talking about mainland visitors to Hong Kong, but also Hong Kong travellers to the mainland. And the number of commuters must be reduced substantially both ways.
While other countries near China are also restricting travel, with Russia and Mongolia closing all or part of their borders. Several countries are also evacuating their citizens out of China. Japan is to send a plane to Wuhan, and the US plans to fly consular staff and US citizens out of the country. France and South Korea have also got evacuation plans, and the UK's Foreign Office has said they are beginning to help Britons stuck in Wuhan to get out. The virus has now spread to at least 16 countries globally. With me is our health editor, Hugh Pym. Hugh, one of the interesting things that we're learning is that the virus is now spread in some countries with people who have not been to China. Therefore, it's people-to-people transmission with no contact from the source at all.
Yes, Geetha, we've learnt that, well, first of all, in Germany, a man has contracted the virus. That was apparently from a colleague who'd been visiting from China, from Wuhan, and had come over to Germany, and so he'd caught it from the colleague. This follows a case in Japan where a bus driver contracted the virus, having apparently been driving around a group of visitors from Wuhan who subsequently went back home. There had previously been a case in Vietnam where somebody's father had picked up the virus on a visit to Wuhan and come back. So this confirms the human-to-human transmission, which has now become widely known, but also that in at least one of these cases, it seems highly likely that the person who had the virus and then spread it to another individual was asymptomatic, not displaying any symptoms. So once again, confirming, it's not a total surprise, confirming anecdotally that you can have the virus maybe for 2 weeks or so without showing any symptoms at all.
When you say asymptomatic, do you mean that they at no point became ill, or just that they were contagious before the symptoms kicked in?
I think what it means is, certainly in the German case, that there was somebody who was over visiting colleagues and wasn't showing any symptoms at all, and then went back again but had the virus. So in other words, was in that 2-week period, right, and didn't know that they had the virus. What's not clear is subsequently what their symptoms were. But this is what can happen, that you can have the virus, you're not showing any symptoms, and that you pass it on to somebody else.
I mean, that's true with so many viruses,
exactly,
isn't it?
Exactly.
Lots of things are contagious before we
Exactly.
actually know that we've got them. What does this mean in terms of governments around the world now trying to control this? And are we becoming too worried about this, given obviously pneumonia and other sort of flu viruses obviously do sadly take out lots of people globally each year?
Yes, of the 4,500 cases we've seen in China, there are only 50 outside China so far. Obviously there may be more. Certainly in the UK they've said it is highly likely that there will be a case. There isn't one yet. There is in Germany and Japan. There are 16 countries where there are cases. It seems that the mortality rate so far, the death rate, is perhaps not as high as what it might be, though this hasn't been properly modelled. And many are saying that it's not quite as severe as SARS, the outbreak that was seen 15 years ago, when there were many cases, and given the globalised nature of travel then and now, it seems likely to spread. But I think what's potentially worrying for health authorities is just not knowing how many people may have travelled to their country and still be there with the virus and are showing flu-like symptoms, but it hasn't been diagnosed. So
exactly,
extreme vigilance, certainly.
Before China even kind of knew or publicly revealed that this was a problem back at, around Christmas or before Christmas. What about countries like India with massive populations, close density? Again, nothing confirmed as far as I know in India, but testing going on in various places. The World Health Organization still hasn't declared an emergency, a global health emergency. Does it need to, or is that likely? Because if it goes to countries with high populations, it's going to be very difficult to control, isn't it?
Yes, I mean, one of the consequences if the World Health Organization declared a global public health emergency is a concentration of resources on countries where healthcare systems need support. So that might include certain countries, it might include India. So that would be one reason why they might do it, if they felt that there was more focus and support needed. Most countries have got as many precautions in place as could be expected at this stage. The other reason why the WHO might do it is because they feel that the spread is becoming particularly alarming, and also that more research is needed and more effort is needed just to try and work out how toxic and potentially fatal it can be as a percentage of the overall number of cases.
Hugh Pym, thanks very much indeed for that.